I was so grateful in that moment that I had something, I'd pinned something down. There was something that I could do, and it was going to give me some more information. I can't change the fact that I have cancer, but I'm going to find out some more information that's going to be helpful to my cause, and that I'm in control and I can do something.
If you're a woman, or you have a woman you care about in your life, you need to hear Leah's story. Canada's healthcare system utterly failed her, and it could fail you too.
So my mother got diagnosed with breast cancer when I was 31 years old, and she was 56 years old after that, and passed away at the age of 59. So I started getting mammograms when I was 40 years old, religiously every year, and felt very pleased with myself that I was, doing the right thing for my health.
Leah found out that she was in the dense breast classification, which puts her at a higher risk and makes finding breast cancer more difficult. Surprisingly, federal guidelines discourage women with dense breasts from having ultrasounds done, even though they've been proven to help. In spite of this, Leah asked for an ultrasound.
Well, the phrasing on the mammogram report tells you your breast density, says you may want to consider other alternatives, and then there's 4 lines about it, and 3 of the lines are basically dissuading you from the other alternative, which is an ultrasound. And what's funny is that I got my ultrasound report and my ultrasound and my mammogram at the end of the day were done 8 days apart, and the mammogram letter says, "Congratulations, you don't have any signs of breast cancer." And the ultrasound later showed that I had an inch of it, and an MRI later showed I had 9 centimeters of it.
Using a mammogram to find cancer in dense breast tissue is like looking for a snowflake in a snowstorm. That's because both cancer and dense breast tissue show up as white. Unfortunately, Leah had to wait a year and a half for her ultrasound. That's a lot of time for cancer to grow, and sadly, it did.
It's hard to describe the feeling of being told, we've found a rather large lump in your breast. It needs to be biopsied. And of course, all I'm thinking is that my mother died of breast cancer. So instantly, I felt fear, I felt anxiety, and all I wanted was to know what it was.
Leah's battle with cancer would become a long, grueling process, thanks to further delays that she faced in BC's healthcare system. After having to wait a year and a half for that ultrasound, she was then told it was going to take months for a biopsy. Not satisfied with another long wait time, Leah looked at her options and discovered a strange healthcare rule in Canada. As a BC resident, Leah couldn't pay for a biopsy in BC, but she could go to Alberta and pay for one there. Similarly, Albertans can't pay for biopsies in Alberta, but they can in BC. These types of bans on patients paying for surgery make no sense, but they're common in Canada with the exception of Quebec. When she was about to travel to Edmonton for the test, Leah lucked out, and cancellation came up in BC, and she was able to get her biopsy sooner, and unfortunately was diagnosed with cancer. She was then scheduled for an appointment with an oncologist. Encouraged by one of her friends who had a similar diagnosis, Leah wanted to arm herself with more diagnostics than were available here in Canada. She decided to get an MRI done while on a previously scheduled trip to the US. When abroad, Leah was able to book an MRI within 48 hours and get the results within hours.
I was so grateful in that moment that I had something, I'd pinned something down. There was something that I could do, and it was going to give me some more information. I can't change the fact that I have cancer, but I'm going to find out some more information that's going to be helpful to my cause, and that I'm in control and I can do something.
While Leah was fortunate to schedule an MRI right away, the results at this stage weren't good.
And at that point, I I lost whatever composure I had, and I was just like, this is bad. This is really bad. Like 9 centimeters of, a primary tumor plus lesions and stuff like that. Like, that's just unheard of. That's not grain of rice. I don't know what kind of grain of rice is 9 centimeters big, but it was starting to dawn on me that I had a real problem here. So it was a really long night. Didn't get much sleep. And at some point, I woke up, or I hadn't gone to sleep yet, and I was staring at the wall, and David was awake too, and I just said, I'm really scared. And he said, I'm really scared too. And I just said, I gotta get all these fears out. And I just said, here's what I'm scared about. And I made this big list, and he told me what he was scared about. And it took us a long time to go through what we were scared about.
Leah returned to Vancouver and met with her surgeon to discuss surgery. She was now armed with her imaging from the private clinic in the US, including the MRI.
And she was so excited because she normally doesn't have those tools. And I thought, wow, here's somebody that spent an incredible amount of her life just getting educated enough to become a surgical oncologist. And we're asking her to do her job with one hand tied behind her back. She was giddy. It was like a kid in a candy store. She had an MRI to look at,
Our healthcare system is in a bad state when doctors aren't even being given the necessary tools to do their jobs. And patients are being deprived of potentially life-saving diagnostics. In Leah's case, it was only by the strength of her MRI that her doctor was able to see the seriousness of her case and flag her for urgent treatment. By Leah's own calculations, this sped up her process by 4 months. And she's certain that meant the difference between life and death.
So when you are facing cancer, you don't know what day it is that cancer moves. You don't know if it was yesterday, you don't know if it was last month, you don't know if it's tomorrow, you don't know if it's okay and it's not going to move for 6 months, you don't know. So every day is really critical.
SecondStreet.org spoke with Dr. Paula Gordon, one of Canada's leading experts on breast cancer. She stressed the importance of screening and confirmed that some women need more than just a mammogram.
So mammograms are the gold standard, but they don't work as well for everybody. And with women with dense breasts, they need more than just a mammogram. They do need that mammogram, but they need more than just a mammogram. In British Columbia, women who have category C or D density can have a supplemental breast ultrasound screening exam. That's not available in most provinces.
The problem is that in British Columbia, Leah had to wait 1.5 years for her ultrasound. And once they found a tumor, they wanted her to wait months for her biopsy. As you can imagine, waiting that long for cancer tests can be dangerous.
For younger women, especially premenopausal women, their ovaries are still making hormones, and if they develop a hormone-sensitive cancer, which is the most common, a few months can make a difference. There's sometimes a difference in the size of a lump the day the biopsy is recommended and the day we actually do the biopsy. And for women with high-grade cancers, fast-growing, yes.
Sadly, Leah went through a lot of suffering because her cancer wasn't caught earlier.
I feel sad about the treatments. I feel sad that so much of my life is taken up with this. I don't even remember what I used to do. I hope I get to go back to that person again.
So, what needs to change? 3 things. First, improve access to and education around screening, including the benefits of ultrasounds, especially for women with dense breasts, which is 43% of women. If Leah hadn't have had to wait 1.5 years for her ultrasound, she may not have needed such brutal treatments like chemotherapy, radiation, and having her breasts removed. Her prognosis for reoccurrence would also not be so dire. We need to make sure that surgeons and oncologists have what they need to best help patients with cancer, including MRIs. Second, it is unethical for governments to ban patients from using their own money to pay for diagnostic scans and treatment locally here in Canada. How many patients die each year because government won't provide healthcare on time and won't let them pay for it privately? Leah had the funds to go abroad and get a scan, but many people can't afford that extra travel expense.
The government says you can buy a big screen TV, you can buy a fancy car, you can buy yourself a pair of shoes, but you're not allowed to buy yourself a biopsy.
In Canada, the federal government is actually cutting funding to provinces that allow patients to pay for health services like ultrasounds. The third thing that needs to change is that government needs to be honest with patients about the risks that long waiting lists bring. The healthcare system should inform patients of all of their options. If long waiting times could lead to death, then patients need to know that they should seek care in other provinces or countries.
It does take time for cancer to grow, so I'm cancer-free. I've come off chemo. It would take some time. So I feel like I have this little window where I can wake up in the morning and feel pretty confident I don't have cancer. So it's this little, I don't know that I will have another period of time in my life where I can confidently say, I am okay right now. Because for the rest of my life, I will be worried that I may not. So it's about learning to live with that ambiguity.
Thankfully, Leah's on the road to recovery, but she has a message for Canadians.
There's this phrase that I think is criminal, and it's Canada has the best healthcare system in the world. Well, it's actually a lie. On no measurable outcome or even subjective measurement is it the best system in the world. We have some of the worst outcomes amongst other countries that also have universal access. So it's a downright lie.